The state also stepping up contact tracing, but is it too little, too late? It's an important step to understand and control COVID-19 as cases continue to hit record numbers. New data from the tracking site COVID Act Now shows Arizona at a critical risk level for the lack of tracing. ABC 15 reporter Nicole Grigg with the pressure to ramp up contact tracing quickly and the calls for help from the front lines.
It is an exhausting job emotionally and physically, but it is also very rewarding.
Stella Gore is a contact tracer for Gila County. It's a job beyond 9 to 5.
The positive result can come in at any time. We normally won't start making phone calls until 8. And there's been times I've contacted contacts and positive cases at 9:30 at night.
Arizona, one of 4 states in red, considered a critical risk level. COVID Act Now finding we have too many cases and too little tracing at just 1%. Just yesterday, the governor making this announcement.
We are also going to call in the National Guard so that we can surge on this, with 300 guardsmen being called up to help with this.
This move to now bring in resources for contact tracing is 33 days after the governor's stay-at-home order expired.
You ask if it's 300's enough? I don't know. That's probably a question for DHS. But what I do know is that if we do see a need and if it is authorized through the governor, we can call in more.
The question is the community-wide spread too much for a few hundred contact tracers to manage?
There's never going to be enough. I mean, I'm just going to be honest with you.
Will Humboldt, the former state public health director, says contacts made with positive cases will have to be prioritized.
Let's find the family members, the roommates, the really close contacts. If there's some coworkers with close contacts, let's track those down and then move on to the next case because there's not enough time.
The state telling me, based on a 6-week average case count, they would need around 400 tracers. They already have 150 tracers in the counties and now the 300 guard members.
We're hoping that the first 40 will be ready to go as soon as Monday. That's the objective.
Guards members don't have to have medical backgrounds. They just need to have training to do contact tracing. We did ask the state health department if it's a little too late at this point with how widespread transmission is in our community. They did not answer that question. Reporting in Phoenix, Nicole Grigg, ABC 15, Arizona.
ABC 15 analyst and former director of emergency management Wendy Smith-Reeves says the National Guard is great at helping fill gaps in places like contact tracing, so long as they get the training needed to do the job. As far as the other changes announced yesterday, she says it is a good step forward.
I think we can argue that these steps should have happened sooner, but it's great that they're happening now. So it sounds like the governor has been listening to the outcry of the people and of the elected leaders within the communities around Arizona. Those mitigation strategies absolutely do work, and if it comes to a point where we have to impose that at the local level, then that's a good thing in slowing the spread.
She says she's curious to see if local governments will be asking for control over other aspects of the pandemic response because of yesterday's executive order. It applies only specifically to masks.